So period poverty is an issue that I've been kind of aware of since 2015 when I saw it in the news and was kind of struck by the fact that this is something that nobody is speaking about, and I wanted to elevate it to being a little bit more in the public eye. When somebody's in hospital, it's often a very traumatic time for them, can be some of the worst times of their life, and what we need to do as healthcare professionals is ease that in any way we can. And I think one of the key ways we can do that is by providing patients with everything that they need upon their admission, and we're very good at doing that with their food and with many toiletries, razors, toilet paper. These are all things that patients can go into hospital and not worry about, whereas sanitary products have kind of fallen by the wayside and they're not particularly considered. So I originally proposed the motion at the Medical Students Conference and it passed there, which was really exciting, and a couple of months later got the news that it would then go to the annual representatives meeting down in Brighton, and that was really overwhelming because it was an opportunity to bring it to an even wider audience and potentially impact wider BMA policy. So I brought it to the conference and proposed it, and it was successful. So the BMA put out a Freedom of Information inquiry to all trusts and health boards across the UK to find out a little bit more about their provision of sanitary products in hospital to inpatients. And the results were quite astounding. What we found was only half of trusts and health boards were providing sanitary products for their inpatients, and only 20% of trusts and health boards had sanitary products readily available to purchase on site, which is quite shocking when you think about it. I think the thing that struck me most was the fact that not a single trust or health board had any firm policy in this area, which I definitely think needs to be something that is done just to make sure that we are meeting the sort of minimum requirements. When patients are under our care in the NHS, we need to make sure that we're making them feel as welcome and as looked after as possible, and by not providing them with something so key to their health and well-being, that's definitely going to have an impact on their sense of self and their sense of dignity and cleanliness, and by not providing this for them, we're kind of withholding that dignity from them. Moving forward with these results, I think what we really need to do is push for firm policy being put in place with regards to sanitary products for inpatients in hospital. I think patients should be able to expect the same in one hospital at one end of the country to another, and I think that provision should be there. We've shared the results that we collected with the NHS and asked them how this problem can be best solved, and we hope to have a solution to that soon.